My name is Jennifer Hartshorn, and I am a dentist and faculty member at the University of Iowa College of Dentistry in the Geriatric and Special Needs Clinic. I teach and provide treatment to many patients with varying disabilities. Many people with disabilities receive their dental care from general dentists and pediatric dentists. In this video, you will meet 3 dentists, 3 people with disabilities, and a parent of adult children on the autism spectrum. Everyone will describe what quality dental services mean to them and provide tips on how to offer quality services.
My name is Dr. David Gugliano. I'm from Iowa City, Iowa, and I attended the University of Iowa College of Dentistry and graduated in 2014. Currently, I am a practicing general dentist at the Family Dental Center in Coralville, Iowa. Well, here at the Family Dental Center, we do take a family approach to dental care. So we do like to see mom, dad, all the kids. We like to see the family as a whole. You know, we do come in contact with families that have, children with special needs or spouses with special needs.
My name is Michael Kalupa. I have cerebral palsy. So because of my cerebral palsy, I have some spastic issues.
Hi, I'm Polly Ivan, and I'm a pediatric dentist in Coralville. I tend to have a little broader spectrum of patients. I see kids from infants, newborns that need their tongues clipped because they can't nurse properly. And then I see them all the way through college. I also see many children with special health care needs and disabilities. I love the fact that I am treating a wide range of ages and different types of people with different types of needs.
I'm Mary Roberts. I am the parent of 2 young adult children, both of whom are profoundly affected by autism. They are both nonverbal and have significant behavior involvement, and we have been going to the dentist every 6 months for their entire life.
My name is Mike Honick, and I've been blind since birth.
Hey, good morning. My name's Steve Armstrong. I am a professor at the College of Dentistry. I've been a professor since 1999. Mike's been a patient of mine the bulk of that period of time. I'm also the chair of the Department of Operative Dentistry.
So my name is Carly Armour, and I grew up in Georgia. I was born profoundly deaf in both ears. I've had a lot of experiences in going to the dentist, especially since I grew up with well water.
Dentists often wonder if they need special training to provide quality service to individuals with disabilities.
So Mike asked me to come and say a few words about being a dentist and caring for people with disabilities, or in this case, a blind person. And I was I was kind of surprised. That's because I don't have any special training. I don't have a vast amount of experience in that. But then I realized that that's probably the biggest point that I can make about this, is that you don't necessarily need extensive training or unique experiences to do a good job for patients with various disabilities. You just need to do what you should be doing for every patient at the standards as if they were a family member, and to provide high quality care.
Pediatric dentists are trained to know about a lot of different syndromes, a lot of different other types of disabilities. That doesn't mean that every person that comes through your door, you have to be an instant expert on them. You need to have the ability to realize that you're not as strong in a certain area, and you need to familiarize yourself with whatever this patient presents with so that you can treat them accordingly and properly. I think a person's greatest strength is knowing what their weakness is, and just say, I'm not very comfortable dealing with your type of disability, but I want to learn more about it. Would you be willing and be patient with me while I learn to treat you in the best way possible?
Often we get calls asking, well, do you, my son has Down syndrome, for example. Do you treat patients with special needs? And, our answer is, why don't you bring him in at your next appointment? We'll get to know him, and then we can kind of take an initial assessment and see if he's someone that we can provide care to adequately. So at the Family Dental Center, we don't market our clinic as being a clinic that serves those with disabilities because, that's really not our specialty.
Many dentists wonder if there are general guidelines for referring patients with disabilities to specialists. You should make this decision based on your professional discretion and the ability of your practice to accommodate the special needs which your patient presents. One approach is to provide routine preventative care in your office. If you feel uncomfortable with more invasive treatment, you may refer the more challenging dental care to a specialist.
What we do is we like to at least meet the person and see if we're a good match, if we're a good fit. And if it is a situation in which we do have to refer the child or the person to someone that can better help them, a specialist, we just like to think of that as more being a team approach to providing care for this person. When you're in private practice, you're very, very dependent on the team around you. And that ranges from every single person that interacts with the patient. Having open lines of communication with your support staff is crucial to be able to deliver the appropriate care to the patient. The hygienist is going to be the person that really gets to interact with that patient. Patients that we're able to treat here and patients we aren't, kind of getting their feel for the situation is only going to help you make your ultimate decision with treatment.
The Americans with Disabilities Act requires dental offices to be physically accessible and to provide a specific number of handicap parking spaces. Dr. Gugliano will describe the proactive approach which his office took to meet and exceed these requirements.
So yeah, there are laws obviously to make offices and buildings handicap accessible, and we recently did a remodel of our office, and we found that actually sometimes it pays to even go a little beyond that for having a good experience for your patients. We had handicap parking out front, like you should, with the ramps and everything, but we found that the spots were actually really far away from what became our new front door. So they were so far that when you look out the front window, our receptionists couldn't see the patients that were getting out of their cars that may need, help. We had 2 handicap parking spots added to right in front of the front door, and we have that extra painted space on the driver's side of one and on the passenger side of the other. That way, it can accommodate cars that have the ramp that comes down for the wheelchair on the one spot, and then the other space for those that are able to drive themselves but then have to turn around and get a walker or a wheelchair or something out of the back seat. It gives them room to do that as well. So our front door was not automatic originally. If no one was with them, it was really hard for them to get in. So we've added the a little wider doors and the automatic opener to make that a little easier for people to get in and out.
Sometimes questions arise about whether service animals should be allowed in dental practices and about the roles which these animals play. In addition to considering the comments from Dr. Gugliano, which you are about to hear, we encourage you to refer to the webpage for this video to access links to resources about service animals.
In a dental clinic, a lot of people, they have a lot of anxiety. And some service dogs, can be used to calm for anxious. There is also the concern of having an op that's sterile, or as sterile as it can be, as clean as it can be, and the last thing you want is your next patient to come in and see dog hair. There is a kind of a balance you play, but if we had someone, for example, come in with a service dog, we do have an operatory that's our overflow room where it's not used all day. So, that would be a great op for that, where we could bring the person in, go ahead and treat them. And then if the dog was shedding or something like that, go ahead and run a quick vacuum. Most service dogs obviously are service dogs for a reason. They're trained, they're very well behaved.
Now let's look at some common sense tips that facilitate the provision of dental care for people with disabilities. You may begin by adopting a person-first philosophy.
The patient is a person first and foremost. The disability does not define the patient.
They're there to get care like everyone else that's there.
Everybody has differences. Every person is an individual, whether you have a disability or not.
When I walk into a room, I always address the patient first, regardless of their comprehension level, and you have to deal with people on an individual basis, even people that might have the same type of disability.
It is important to develop relationships with patients with disabilities, just as you do with all your patients.
As with any patient, developing a relationship is really important. And for me, it really paid some big dividends. For instance, one of my dentists learned fairly quickly that I was a huge baseball fan, and we happened to share a like for the same team. So that, of course, was the beginning of our conversation each time. But as that relationship developed, he realized that I had some other concerns that maybe other patients wouldn't have, and one of them was being able to get to the appointments, because I lived in one community and his practice was in another. So he started arranging transportation for me. Oftentimes his wife actually would come and pick me up. And I'm not saying that as a dentist that you should be expected to do that, but it turned out to be a win-win situation for both of us, because he kept my business and I got good dental health care.
For children and for adults with disabilities who need assistance in expressing themselves, always ask about the relationship between the patient and the accompanying person rather than make assumptions. Also, it is important to identify whether the patient has a legal guardian.
The caregiver is also very important because we have to form a team. We have to work with the caregiver and make sure everybody's on the same page so that that patient is getting the best care possible, both here and in the home setting. In terms of things that you have to do that are uncomfortable, like giving an injection, I talk to the parents first of kids, or the caregivers if I'm dealing or working with a patient with some type of a cognitive disability. How do you want me to deal with the shot? Do you think your child would be better knowing that they're getting a shot? Or do you think we need to use some distraction techniques and try to let them know as little as possible? And the parents will give you a really good idea, and the caregiver. Some kids want to know. They want to see it, then they want to know it, and that helps them cope.
I think it's important to realize that every person with autism is a person with autism. None of them are the same. They each have different nuances of behaviors. And that it's going to be in your best interest as a provider to visit with the parent or the primary care provider beforehand to find out if there are things that can be done proactively to help the appointment go more smoothly. As far as controlling the environment in a sensory capacity, I would really encourage that minimize personal fragrances, perfumes, colognes. As far as air fresheners, any kind of artificial fragrance is going to cause more hypersensitivity for a person with autism. Fluorescent lighting can also be agitating, and especially if they're laying up and looking at the fluorescent lighting. Some clinics will have a sheet that goes over the light to kind of diffuse the light so it's not as direct. So it's something that if you find something that works well, I would recommend sticking with it. It's something that if you would like to work with the parent, if they are interested in maybe removing some of the adaptions based on how well the child's doing, do that cooperatively with the family. Don't make those decisions unilaterally without their input.
The following examples are simple ways to adapt your communication strategies to meet the needs of your patients with disabilities.
There are some systems available. For example, here at the hospital in Iowa City, there seems to be some kind of a trigger system that when they see that I have an appointment, they automatically contact me through email and ask me if I want a sign language interpreter for the appointment. I really like that because sometimes I do need one, sometimes I don't. And I want to do whatever is best for the communication, but also help the business. So at the dental office, it's very common that a person will call you into the room and then they walk in front of you just blabbering away, asking you questions. So that's when I say, hey, just to let you know, I'm deaf and I can read your lips. So if you're asking me a question, I have no idea what you're saying. So you kind of sound like Charlie Brown's teacher to me, wah, 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 wah. And they usually laugh by that point. And so they walk beside me instead of in front of me. So obviously they have to wear a mask, right? So right up front, I talk to the person and say, so I know that I'm not going to be able to read your lips. So is there any way that we can come up with some communication plans so that neither one of us are getting frustrated and also for safety reasons? But pretty much in all cases, do not exaggerate your lips when you're talking. It makes it harder for the person to understand you. So do not talk like this. Just keep it simple, talk at your normal tone unless the person tells you to speak up.
Visual cues can be very helpful in working with a patient with autism. They're very visual thinkers and visual learners, and so they'll have an accurate idea of what to expect before it happens. So for example, if you are going to be doing x-rays, there can be pictures, and they can either be actual pictures or they can be drawings. They can be, there's a program called Boardmaker. They're kind of pre-drawn pictures that can plot out the procedure, and it can be depending on the patient's ability to understand, and this is something that you should discuss ahead of time with the care provider. It can be 2 steps that, open your mouth and put in. It can be 10 steps that really kind of plots out very specifically what they can expect and what the procedure is going to involve. And a lot of times being able to see it ahead of time, and then as you're going through the procedure itself to kind of reiterate, this is the step we're on and this is what's going to happen next, really helps them feel part of and aware of what's happening to them.
The dentist stops and says, okay, this is what I'm going to do. It doesn't take very long to do that. And I realize that dental practices are very busy, but those few extra seconds, literally, oftentimes that takes less than a minute to do, really helps with developing the relationship and developing the confidence.
Use TeachBack to ensure your patients understand the information you have provided. This includes asking the patient how they are going to incorporate your information into their daily routine.
It's very important for any patient to understand what they're supposed to do prior to a procedure and after a procedure. But many times if a person is blind or if a person has some sort of a learning disability where just handing over a piece of paper with instructions really isn't going to work very well. And in many cases, we as patients who can't read the printed word for whatever reason are hesitant to speak up and say, well, gee, I can't read that. When I was younger, that very thing happened to me. I was going to have 4 wisdom teeth removed. So they handed me the instructions, which of course included that I was not to eat or drink after midnight prior to the surgery. So I just went along and did my routine, which included eating and drinking after midnight before the surgery. The surgery was successful, but I experienced some significant problems afterwards with illness and things that could have very easily been avoided. So doing a little bit of problem solving and checking things out with your patient ahead of time to make sure that they either have someone that's going to read it, or perhaps you could figure out, you could send the document to the person by email. Perhaps you could put it on a jump drive as a patient leaves, either prior to the procedure or after it, that you feel comfortable that they know what the instruction is that they're supposed to follow.
The following techniques can be used to help reduce anxiety and build trust.
It's really important to gain that trust, because that trust is what makes the experience a good experience for your patient. One of the things you can do, for example, if I'm going to do crowns or fillings on front teeth and I want to make sure it looks good for the patient, they don't know me very well. Sometimes I would suggest, why don't you have a close friend or family member come with you to that final appointment?
And it might be very easy to assume that, well, gosh, if they're blind, it isn't really going to make that much difference. But that having good teeth and a good appearance is very much a source of self-esteem for me and for many other blind friends and colleagues.
I will talk them through each step and describe it a little bit. But with a blind patient, you're going to have to go a little bit further with that explanation. Describe it a little bit more, maybe to the point of hand the instrument or the object, the whatever you're working with, and let him or her feel it first, and then begin. Where I may provide a little bit more information for his informed consent of treatment decisions was he needed a crown. So I brought out a model, and I just had him handle it and feel it, and then he could understand what was going to be done to his tooth. We talked about why it needed to be done, and then we talked about the material choices.
The first time that rubber dam was going to be used on me, a dentist actually let me touch it. When the leaded apron was going to be used, I was given the opportunity to touch that. And so just basic things really eased my anxiety tremendously.
I have a gag reflex that is pretty strong, so when I go to the dentist, I have to actually take time before the appointment, talk to them about the things I need. I bring a 5-pound sandbag with me that I put across my legs to keep my legs down, because sometimes if I get startled by a certain sensation because of my spasticity, my legs will pop up, or I'll kick forward, or my left hand will go up like that. So being that I have something on my legs to hold my legs down, it kind of controls that so that I'm not so spastic. And I make sure that I tell the dentist about the situation and talk to him before the appointment so that he knows what I need to have a successful visit. So I have anxiety when it comes to dentists. So as long as they tell me what they're gonna do before they do it, and they ask me periodically through the appointment if they can stop, or if I have to stop, then give me a little bit of a break, and then that's about it. So it's pretty normal.
A lot of people with autism have pretty, they have a lot of difficulty with sensory dysfunction. And so things that we as neurotypical people might not be aware of could be extremely anxiety provoking to them. So to be made aware of those ahead of time could be very helpful because you could take steps to help minimize that. Sound is a big one. So minimizing sound, especially unnecessary background noise, like a TV in a waiting room, if that can be muted. Radios playing in the background of the office space can be extremely agitating. There's going to be some sounds that cannot be changed, such as drills or things like that. A lot of parents will bring headphones with to kind of cut down some of the background noise or the sounds. It might be something that you can have extra noise-canceling headphones available in your office. Touch is another tactile. Autistic people tend to be very tactily defensive. So one of the things that I do with my son, for example, light touch is like extremely agitating to him. But we kind of use very firm touch when we need to touch him to move him or reposition him or something like that. I would defer to the person that's with the patient and let them do any repositioning or moving that needs to be done. Obviously, you're going to have to be touching the mouth area, but minimize any touching outside of what's absolutely necessary. Taste is another one. If there's an option to have something that does not have flavor added.
We encourage you to work with patients with disabilities and their families to make special equipment available. Employing distraction techniques when appropriate may facilitate relaxation and a quality experience.
Sometimes a parent will ask for an adaptation that might seem odd, especially if the child is an adult and adult size. An example with my children is I insist that bite sticks be used, even if my child's being very relaxed and cooperative, because it could be a flip of a switch that they're not, and it's not a chance that I want to take that they would end up biting the provider.
All of our treatment rooms, we have things on our ceiling that are good distractions. We have I Spy boards on each room's ceiling. The dental assistants are in charge of making sure that the hands are not going to come up and grab. And so they're very, very good about. So another distraction technique with patients with autism is using some type of a weighted blanket, or we use several x-ray or radiograph gowns, leaded aprons, because that tends to make them feel more comfortable. Often if we'll put a weighted, the gowns on, the x-ray gowns on, they'll relax, they'll calm down. A device called the Papoose board in certain situations can be very, very helpful, especially with children or teenagers or adults with autism. If they feel more comfortable wrapped in a Papoose board, which is basically just a board with fabric that comes up in Velcros and just makes them feel snug and secure. Obviously, we're not using it as a punishment device or as a way to overpower the patient. We only use these if we think it's going to help and the patient is on board and the caregiver is on board. We have a movie playing in this room constantly. We talk to the parent before and say, this is the movie we have playing. Is that going to be okay? If it's not, we switch. Sometimes parents will bring their own movies in because kids will have a movie that they like.
Sometimes thinking outside the box allows you to come up with creative solutions.
You have to be flexible. One example is when I first started practice, I was contacted by a group home for adults with disabilities and special health care needs. This particular patient has a hard time entering dentists and doctors' offices, and extremely low functioning in terms of cognitive ability and communication. So we scheduled him after patients were gone, and we were hoping to get an exam, and because he hadn't been seen for quite a while, a few years. We thought we had everything prepared here in the office, and as it turns out, he wouldn't come through the front door of the office. Group home providers were concerned that he had some cavities, and they were worried that he might be having some pain because he kept hitting his mouth, and so we were worried that he had a toothache. So I couldn't just throw my arms up and say, well, I can't get him in the office, so too bad, go someplace else. There was a picnic table on the yard outside our office, and they were able to get him on the picnic table before the appointment. I said, well, let's go out onto the picnic table and we'll do the exam there. I just wanted to try to get an idea if this was an emergent situation, what we were dealing with. Did he have an abscess that could be jeopardizing his health or life, possibly? What was happening? So I'm willing to do stuff like that to get the job done. Sometimes the child will absolutely refuse to go in the chair, so we do what's called a knee-to-knee position with the parent, where the child stays on the parent's lap. We may make a little bridge or bed with our knees, and the child puts his or her head down on my lap, and we do the exam that way, or the cleaning that way. There's even some types of cavity procedures, that cavity restoration procedures that we can do in that position.
We encourage you to take advantage of the many resources available to assist you in serving patients with disabilities.
The patient is going to be your best resource, but you may be the one that needs to be proactive in asking the patient. And then it's also a good practice to make sure that you really that you're on the same page.
You get a fairly good broad training in dental school, and even as a specialist, you're not expected to know everything. This day and age, good information is very accessible. So if you have, as a general dentist, a patient coming into your practice that has some type of a syndrome or some type of other type of disability, I would try to recommend learning as much about that disability as possible. And the way that you can do that is by contacting people at your dental school. There's also some incredible resources on the internet, but be careful, make sure that these are reputable resources. Reading up-to-date journal articles on types of special health care needs or disabilities can really help increase your knowledge base. There are a lot of specialists out there. I would go right to the source, find out who's the best in their field in that certain disorder or disability, and talk with them. Try to pick their brain and find out all the pros and cons of what do you have to be careful of and what do you have to watch out for, and how can you better enhance your treatment of them.
We hope that the information which we have presented will assist you in providing optimal dental care to your patients with disabilities.